I think a big problem we have is education, and whenever medical cannabis has, as we've seen, legalised across Europe, and the governments have made that change, they haven't bridged that gap between the law change and education.
Cannabis education, a public approach. What sorts of public awareness campaigns are needed to destigmatize medical cannabis and give appropriate information on the available options? Moderated by Maya Elizabeth, Omand Whoopi and Maya. Basha Janjevic, the Center for Medicinal Cannabis and Families for Access. Robin Emerson, campaigner and advocate for medical cannabis. William Levine, CanRx. Moritz Förster, Krautinvestor.de. Julie Maltke, Dosage.
Thank you so much for having us today. I'm super excited about the panel. And I know we only have about 20 minutes, so I'll dive in with these brilliant, beautiful individuals. Let's just get started. My name is Maya, by the way. So we all know that legislation can be a slippery slope. What types of systems, if any, should be implemented to ensure public safety through cannabis consumption? If whoever would like to start, we can go down the line and...
Yeah, sure, I can start. I mean, as a medical doctor, I'm a medical doctor and educator from Copenhagen University, and I would say that, of course, there are many different systems that we need to have in place to secure safety, but I would say that the number one is the research, that we have systems in Europe that are working together, scientists and researchers who meet up at conferences and actually share the knowledge that we find within countries. Because, like, I remember a couple of years ago when it was legalized in Denmark, medicinal cannabis, one of the big sort of like hurdles was that the doctor said there was no evidence, but that is absolutely not the truth. We've been researching cannabis for the past 70 years, so yeah, I definitely think that research is one important thing that we need to have in place. What do you guys think?
So Crowdinvest.de, which I founded in 2017, is a German industry platform magazine for experts, investors, business leaders. And I also work in PR for almost a decade now. So I give you some opinions about the media landscape out there and what I think needs to happen. What we see currently in Europe is a massive gap of information regarding many very important stakeholders. For example, we have financial journalists, we have digital journalists, real estate journalists, but we have not enough real cannabis industry journalists yet. This lack of information is, in a very fast-growing economy, offers the opportunity to overpromise and to bullshit too much. And this is the worst thing which can happen, because then we lose trust and we lose credibility. What we need to make this industry a success and to continue our path, we need to find models that information will reach the right stakeholders on a factual basis.
Hi, Bill Levine from CanRx. We basically develop technologies to make cannabis a consistent, therapeutically safe drug. So if you look at the cannabis industry, actually, from a stigmatization perspective, the public across the world has really voted, let's get cannabis into mainstream medicine. The government, surprisingly, has agreed with that concept. So the government at the top level has said yes, the public has said yes. I don't think there's a big stigma associated with it anymore. The gap between the government decision and the destigmatization comes actually from the medical world, where they're saying not so fast, because we don't have the data that we need, we don't have the consistency that we need, your products are not showing us what we need. Well, that's true, and that will take us another 100 years to get there. So how do we basically bridge that gap, and that will destigmatize it? Basically, we need to work with the government, and the medical agencies, to convince them that this is a responsible industry. And the gap will be closed from both directions. Education of the medical world, which is taking place, and it's public. It's driven by the public, and actually, it's also an industry issue. The industry has to upgrade its demands for safety and efficacy-driven products. We can't live in this world where we just sell whatever we can. We have to upgrade. We have to get better, scientifically driven, and safety data-based products to the public.
Yeah, I agree with that. I think a big problem we have is education. And whenever medical cannabis has, as we've seen, legalized across Europe, and the governments have made that change, they haven't bridged that gap between the law change and education. And that's a big problem that we have. We can see in the UK where this decision was made, the law was changed, yet we're 1 year with the law changed and not a single prescription has been given out on the NHS. All the prescriptions are of a private nature or for the pre-license with the Hannah Dingley story, but we must educate more, we must bridge that gap that we haven't done, and we haven't done that successfully, and I don't actually think anywhere in Europe has maybe done that successfully yet, and being able to bridge that gap. And there's no point making something legal if nobody is educated on it and doctors don't understand how to prescribe it, what products are available, what doses should be done. We need to fill that gap. We need to show them how we do that.
Hi, Basha, here from CanTalks and CPAS, Cannabis Patient Advocacy and Support Services. To back what Robbie and everyone else is saying, actually education is absolutely critical. Speaking as an arts educator with my background, of course education is the answer, and so we wouldn't expect the government or the doctors to be the teachers, so that's where the other experts have to come up and come forward. And so for CanTalks, being an acronym for curating a new normal, we're engaging artists to work with scientists and also philanthropists, philosophers, anthropologists, the public, the experts in their fields to come forward at the University of Cambridge to talk about what should cannabis look like in the UK, because it's not the US, it's not Canada, it's not Malta, it is the UK. So everyone needs to create their own culture and curate it with their own backgrounds and expertise, but with an open mind. And with CPAS, Cannabis Patient Advocacy and Support Services, what we're doing as the campaigners, as the ones who are looking down the critical path, the patients come first. This is a patient-led revolution, as Hannah Deacon said. We're bringing forward the carers, the experts, the nurses. So we're actually launching a nurse's arm so that they can be the ones to look after the patients and be the conduit between the patient and the doctor.
Thank you. Thank you. Perfect. Beautifully well said. I think it's fascinating to see what CBD is doing for cannabis worldwide. It's really helping to destigmatize and start the long overdue conversation. Part of the way that we see that is through online sales and rights for banking and all the doors that CBD is opening. How is CBD affecting cannabis and THC? Is it making it easier? Are these conversations starting to be started more easily now? Is it decriminalizing, or is it making it more challenging in some way?
If I should start, I would say that it's a double-edged sword in a way. I mean, of course, it's great that it's raising awareness and, in a way, destigmatizing cannabis as a whole. But it's also like bringing medicinal cannabis into a position of like not being a serious medicine, at least the way I see it in the UK and in the rest of Europe, where it's not, like CBD is not really regulated, so we don't actually know what's in the bottle. Consumers don't have any sort of like guidelines on like what they're getting, how to use it. So again, here we're lacking education, and we're lacking like governments all around the different countries to take responsibility, I think. Because I was at a big conference for doctors in Germany this week actually, last week, and there like one of the big sort of like topics was as well, like what should we do with CBD? Should it be a medicine? Like people use it as a medicine. People use it for anxiety, they use it for pain. Isn't that a medicine? Shouldn't that be regulated strictly so that we know what we get? It's a double-edged sword. I think it's really important that that people understand that cannabis can be different from smoking, but also it can bring us in a difficult situation. What do you guys think?
I agree to 100% with what you said. First of all, I also think that CBD has already been destigmatized. But I also agree that if I read the news nowadays, I think CBD is good for everything. I mean, CBD for that, CBD for that, CBD for that, and there are so many promises out there which might hit back at one time, and then CBD did not do us a favor, but in return, it gave us a little shady image. So I would really, my wish is that we step a little bit back and try to argue again on a factual basic and based on facts and empiric data, and not on some kind of myth. This is what I think is needed now from everyone in this industry, and then CBD might do us a big favor for the whole plant.
So it's an interesting phenomenon because, one of the things, cannabis doesn't exist in a vacuum. It's basically a plant-based medicine that we know from thousands of years of ethnobotanical data that it's biologically or pharmacologically active. So what we don't know from that data is are single isolates active. We just didn't know that. We know THC has an activity. We didn't know anything about CBD really. And along comes GW Pharma and Granzonep-Dialex trial and actually shows, wow, CBD alone, not being in cannabis, has a therapeutic benefit. Also some safety issues. It's documented in the evidence. When people are screaming out, wow, look how great CBD is, it is great. It solved this intractable epilepsy problem in a way that the existing pharmaceutical answers could not address. Fantastic. But there are safety issues. I don't know if you were listening at the dosaging that they were giving that child, and it was the right thing to do, but they were putting him into the zone of liver toxicity, well documented. So do we want to let CBD be an OTC drug where people are taking it with no prescriptions, which is fine, but in doses which are not necessarily safe, and then starting to sue the companies that manufacture it because they had liver disease? We don't want that. So we have to address the area carefully. We want CBD to be available, but we have to give the public and ourselves the evidence and the information that they could take it responsibly. So the craze is, like I said, crazy. But there's no question that it should be used for many, many different applications, because we also, the same way we know the toxicity, that also means we know the safety range is good too. So yes, it has a great place in our future.
Yes, I agree. It has destigmatized things, but the big issue that I see with the CBD market and where we are is regulation. And I would call for a lot more regulation on it. We can see companies popping up all over the place at the moment, new CBD companies, and I think it's very worrying and telling whenever you speak to a lot of these people involved that their understanding of cannabis and the medical cannabis and the plant is next to zero. And that's extremely worrying. And again, when we are testing a lot of these products that have been done, and what is actually on the market is not what it says. And this has to be addressed, otherwise it's going to cause more problems to the medical cannabis as a whole, because if we get products out there that causes harm to people in the CBD market, then that's going to overlap into the medical side, and that's going to scare doctors, and they're going to hear and they're going to say, but we hear this happened with that person. So to me, it's extremely important that we regulate the market a lot stronger than what it is currently being regulated. And it is a medicine, and we treat it as a medicine and not as a fad and a quick pound to be made. Which I've unfortunately feel that that's the way the market has gone, and I hope that over the next 12 months we see a lot more regulation within the CBD industry.
So I'm not personally the expert here, but when I'm thinking about the experts with the caliber that I trust, that advise the work that we do. Case in point, I'm thinking right now Dr. Derek Tracy, who is a leading psychiatrist in the UK, also an advisor to the part of the ACMD and a government advisor, one of the people who actually was instrumental in advising the government to change the law when they did. He talks about cannabis as a medicine to not be approached without risk, and actually we should be looking at it as we do with everything. He points out this book that prescribers draw their prescriptions from, saying that there's over 3,000 different prescriptions and there are 3,000 different types of medicines to prescribe from, and not a single one come without a risk. So if cannabis is one of them, then that's pretty surprising. And actually, we should be regulating it, as we heard from John as well yesterday, who's my partner in CPAS, and he's co-authored the CBD report for the Center for Medicinal Cannabis, was instrumental in testing the CBD products that exist in the UK at the moment, and found that there was little bottles like this being sold for £90 without a single ounce of CBD in it. So yes, regulation is important, and yes, we have to be a little bit more critical when we approach any kind of medicine that's being implemented in the system. It just has to be safe, but of course we know that it can be effective. So we just have to be critical with how we handle it.
We have about 4 minutes left, so I think we have one more question, a juicy one that I really appreciate. Have you heard about the vapor deaths that have happened recently? I'm not sure how far the news has taken them, but there's been some deaths from tainted vapor pens that have glycol in them, which is essentially glycerin, and when you smoke it, it can sit in the lungs and people have died. I remember in the States, Obama tried to say, let's not have flavored vapor pens. They're kind of appealing for children, right? If it's an adult medicine, do we really need to have a flavored vapor pen, or do we really need to have a lollipop? Isn't that just a lozenge with a stick in it, right? If we're dealing with adult medicine. In your opinion, what forms of consumption should be prohibited or more regulated than others, or what types of ingredients maybe should we not allow to be mixed? Should we allow for cannabis and alcoholic beverages to be made and consumed? Should we allow for hydrogenated oils to be in cannabis food when people are using that as an alternative for medicines, or as a medicine in itself, I should say? What about tobacco and cannabis? There's a lot of people doing pre-rolls in the States and people want to wrap them in tobacco. What's your take on that, you guys? Should we be starting to regulate, or is it that slippery slope thing and just let everyone have a free-for-all?
Yeah, I'm going to start again then. I do think that is already quite tightly regulated in Europe. I have a hard time seeing that we are ever going to see tobacco and cannabis products, or even, there might be alcohol and CBD, but it's probably more going to be non-alcoholic and CBD, in my opinion, because the laws here are already quite strict. We're getting the CBD sort of like sweets and gummy bears, and I guess that's fun, but that's more the health and wellness industry, isn't it? So I guess it can become a problem, but I don't see it yet at all.
I'm no food expert at all, so I won't give any recommendation about what kind of foods should be on the market or not. But I think we're dealing with either pharmaceutical product and with patients who suffer pain and cancer or whatsoever, and everything needs to be 100% waterproof if we go to market. And on the other hand, it's more or less the same with the recreational sector. If we offer a food or something, then we need to be waterproof that we don't harm people. And if it does, this is the worst damage which can happen to the industry, right? So be a bit more careful, and you will benefit in 5 to 10 years, definitely. That's my general advice, but I don't give any advice to any specific product.
So You referenced the vaping crisis that's going on now globally, in a sense. And it's not really just a cannabis problem, it's an e-cigarette problem as well. But if you think about it, really, these flavors were created for ingestion. They were basically they were created for taste. I don't know why we imagine that since it's safe for eating, it would be safe for inhaling. I don't know that flavors are the problem here. Nobody really knows. The greatest minds in epidemiology are trying to solve this problem, and nobody's really identified exactly what the cause is. But the issue is we basically, the industry is not following a process. In other words, safety has to be shown in every area that it exists. So you just can't take a product that's deemed safe for ingestion and then start inhaling it. So I think flavors are here to stay because we're driving consumers and consumer products and quality products that include consumer perception are going to be the industry standard. But I think that it goes back to something I think every single person on this panel has been saying consistently. We need to change the safety regulations and the reliability of the industry in terms of what products they're delivering to the public.
Yes, I agree with that. I think it's definitely about hammering home regulation, and I think that's the key to it. Rather than limit what type is available out there, I think it's about regulating the proper products out there. And I think also how we market products is important as well. We see a lot where we're talking about the CBD industry there, and you see the marketing that's done in this sexualized marketing that's done to trying to make it attractive to different markets. And I think we have to be very careful when we're trying to deal with the medicine and we're trying to professionalize this market and make it proper. And then we have certain brands out there that I feel are dragging us down a different road than what this needs to be, and it really does create problems, I feel, in our industry whenever people take it that direction, takes away the professionalism of what we need to do. So I think a lot more regulation around that would be my preference.
For me personally, from my standpoint, in the first instance, there needs to be access. And then we could talk about all the different sorts of flavors and methods. But in the first instance, the patients need to be able to access what helps them and how what helps them actually is the best mode of administration. And then everything else could come in. But in the first instance, let's just get the people what they need.
Thank you guys so much. This has been wonderful. Thank you.